the time is now 12:01, so we will go ahead and get started. Thank you today for joining us and welcome to today's webinar, which is the fourth of our Work From Home series. My name is Sophia Pereira and I am the Public Relations Intern at the Canadian Institute for Safety, Wellness, and Performance, hosted at Conestoga College's School of Business. Our Work From Home webinar series aims to share the knowledge generated through two of our large applied research projects. We hope to help organizations recognize the challenges of work from home arrangements and provide guidance on evidence-informed strategies to protect workers' health and well-being while improving their productivity and performance. Today's webinar will present the findings from our national survey to understand the impact of work from home. Our speakers for today's webinar are Dr. Amin Yazdani and Dr. Baden Nawrazi Kia. Dr. Yazdani is the director of the Canadian Institute for Safety, Wellness, and Performance. Dr. Yazdani uses a multidisciplinary strategy to develop innovative approaches to prevent workplace injuries and work disabilities at the organizational level. Dr. Yazdani's research interest focuses on integration of human factor and ergonomics in the design of products and work environments. Dr. Baden Nawrazi Kia is an assistant professor at the University of Toronto in the Department of Occupational Therapy and Occupational Science, where he holds the inaugural Emily Geldkeller Grant Early Career Professorship in Workplace Mental Health. Through an occupational lens, his research program is a systematic study of occupations in the area of work disability prevention, return to work, and disability management. The format for today's webinar is a presentation from our speakers, followed by a Q&A session. If you have any questions, please use the Q&A function on the Zoom platform to ask your questions, and we will get to them near the end of the webinar. I will now hand it over to Dr. Yazdani to begin the presentation.
Thank you, Sophia, for the introduction, and thanks everyone for joining today's webinar. In today's webinar, we'll discuss the impacts of work from home on mental health of Canadians. Our work from home series of projects includes research that help us to better understand the impact of work from home on the health and well-being of Canadians, as well as a project that focused on looking at the impact of work from home on productivity and performance. For today's webinar, the focus is on the data we collected from two national surveys we conducted last year and this year that looks into investigating the impact of the mental health on the impact of work from home on the mental health of Canadians. For today's presentation, I start with providing a brief introduction and discussing the current landscape and the future of work from home. And I'll walk you through some of the data and also looking at the national survey that we conducted. Dr. Nawrazi Kia will further discuss the results of that survey. And at the end, I'll try to provide some recommendations to help employers with better understanding of the strategies to address mental health in the workplace. So to put the work from home landscape into perspective, before pandemic, only 4% of Canadians work from home. And mostly that was around voluntary work from home arrangement. During the peak of the COVID-19 pandemic, that number rose to 40%. And then we've realized that post-pandemic, the work from home population will likely be in some sort of a work from home capacity. We see similar trends globally. In the US, remote workers jumped from 17% to 44% of the working population. And in Europe, there was a jump from 10% to 40%, and Australia saw a jump to 50% from 20%. And again, these are averaged to the countries, and different states or provinces within these countries might have varied numbers, and you may see that the numbers are varied widely based on the states and provinces. There is no doubt that COVID-19 pandemic has fast-tracked the work from home trend, but work from home is certainly not a new concept and has been growing in popularity since 1970s. Even looking at literature that looks into the productivity and performance, you see that the literature is increasing. You see that there are a lot of papers coming out looking at productivity and performance, but certainly it's not a new concept. It just happened that the COVID-19 pandemic has caused a rapid rise in the number of workers around the globe who now find themselves working from home. And that COVID-19 pandemic also showed us that workers can work from home and they may kind of perform sometimes in some sectors even better. But again, our understanding from work from home has been only around voluntary work from home or flexible work from home arrangements rather than more mandatory kind of arrangements. At the peak of the pandemic, as you saw in the previous slide, over 5 million Canadians were working from home. Global workforce analytics reports that up to 30% of the global workforce will still be in a work from home arrangement by the end of 2021. Forbes magazine states that roughly 74% of companies plan to permanently shift to remote work. Statistics Canada, on the other hand, suggests that 80% of teleworkers would like to continue working from home after the pandemic is over. And that's exactly what we actually saw in our survey as well. About 30% of people say that they will leave the job if they're required to return to full-time into the office. And yet 70% of CEOs, on the other hand, say that their workforce will indeed be back into office by the end of 2021, according to LaSalle Network. So you see that there is that demand around working from home, and then kind of you see that there are some organizations that they want to bring people back to work, and that is going to be an interesting development over the next few years as how organizations start developing new strategies for remote work. So acknowledging that the way we work has changed, despite not having complete clarity on what the change will look like, it is vital that organizations understand the impact that this way of work has on the workforce in order to ensure that they are equipped with information and resources to ensure that their workforce remains effective and healthy. Many believe that work from home has a lot of benefits, including those that they support evidence around increased productivity, greater focus and less distractions, increased autonomy, greater job satisfaction, flexibility to work around life commitments, cost savings, and etc. Again, most of that understanding is because of our literature around voluntary work from home. But there are also challenges. The work-life balance interference and the inability to unplug, reduce motivation, decrease job satisfaction, reduce productivity, difficult establishing work culture and connections, increase absenteeism, the data around teamwork and the impact that it has on innovation, and so on. So you kind of realize that despite having all these benefits that are outlined in a lot of the scientific or grey literature, you also see that there are some challenges that is highlighted by literature as well. But the consensus is generally that work from home can have positive effect for both the individual worker and the organization, assuming that the flexibility is managed properly and the setup is appropriate for the industry and the job duties, and that setup is kind of being managed in a way that the workers have been considered as the main core within that consideration. So we did a national survey to understand the impacts of work from home arrangement. Again, we're talking about mandatory work from home arrangement on the mental and physical well-being of workers, and how can the health and well-being of Canadian workforce be protected. We also did a study looking at productivity and performance. We had a couple of webinars in the past. You can look into our YouTube for those webinars. And in today's webinar, again, I'm focusing on the national survey and present data related to mental health. We distributed the survey nationwide through our network between October and December of 2020. I remember that was about 6 months after COVID-19 declared a pandemic. This allowed us to examine the experience of Canadians after, again, roughly 6 to 10 months of working from home. And during this period, Canada was experiencing an average of over 5,000 new COVID-19 cases per day. We then launched a follow-up survey with those that participated in the initial survey. So we've reached out to those that participated in the initial survey and asked them to kind of participate in the follow-up survey. And this was done to understand how perspectives and experiences of those individuals have changed over time. To be included in the survey, people had to be living in Canada, be over the age of 18, and be working from home at least 2 days per week. And again, we surveyed people from all industries and sectors. And we had over 1,600 people that responded to the survey on the initial survey, and about 380 that participated on the follow-up survey. The same kind of study was conducted in Australia. We worked with our Australian counterparts. They are right now actually launching the third survey because they're still in lockdown. Before we dive into some of the general findings, it's important that we highlight who this data represents. As you see in my slide, about half of those that participated in both surveys were between the age of 35 and 55, and the majority of them were female, and that stayed, again, consistent with our follow-up group as well. Majority of the respondents were from Ontario. About 37% of people had children, and just half lived with another adult but no children. In the follow-up survey, we saw that these numbers stayed relatively consistent. Job-wise, the vast majority of respondents for both surveys were non-managers and worked for large organizations. The most represented industries including education and training, professional, scientific and technical, public administration and information, media and telecommunication. And perhaps most importantly, about 78% of our respondents had never worked from home prior to the pandemic. So this survey was truly a new way of work for many of our participants. And that was kind of obvious from the data we got. And about 84% of those participating in our follow-up survey were still in a full-time work from home arrangement. So we asked the interview participants about their mental health, and we asked them how would they rate their overall mental health. This graph displays the within-person comparison between the initial and follow-up survey. So this only takes the 382 people, same people that participated in both surveys. The full initial survey was about 1,600, if you remember, and again, and the follow was about 382. And you see here that the initial survey, about 28% of participants rated their mental health as being poor or fair. And you see that there's an increased jump into 35%. And that demonstrates that even 6 months after the initial survey, let's say we're talking about almost more than a year into a pandemic, that the mental health of Canadians gotten worse, if not better, because perhaps the expectation was that over time, individuals will start realizing how to cope with their mental health issues, and organizations put in place strategies to support the mental health of their workforce. Our survey suggests that there's either no change or perhaps a little bit of an increase in how respondents rated their mental health. The mental health, self-reported mental health, were poorest for those in the healthcare and social assistance industries, and that not improve with time, did not improve with time, and more people again rated their mental health as poor or fail in the follow-up survey. Again, this data that is presented here in this slide strictly from our initial survey, because we have group effects presenting this data, and that you see that again, the data in this slide, that the burnout and stress did not change over time between the initial and the follow-up survey. So these questions actually ask people how often kind of they felt burnout or stress, and ask them to choose never, seldom, sometimes, often, always. But for the purpose of displaying the data for this webinar, we combine all respondents into yes and no. So burnout involved 4 questions, and those questions were feeling worn out, being physically exhausted, feeling emotionally exhausted, and being tired. And the stress involved questions around having trouble relaxing, being irritable, or feeling tense. So as you see here, a majority of participants said that they kind of felt that they're burnout or they have stress. And these were more common in individuals who were women, had caring responsibilities, those that they work in education and training industry, and those that they were managers. This graph represents the within-person results from initial and follow-up survey. So we're talking about 382 participants from the initial and the follow-up, the same individuals. And for somatic stress, we're talking about questions around having a headache and have a stomachache as the symptoms. And the cognitive stress includes 4 questions about problems concentrating, trouble thinking clearly, difficulty making decisions, and trouble remembering things. And as you see here, that the somatic stress, you see that there is no change, no meaningful change of how individuals rated these from the initial and the follow-up survey. And again, you see the same thing with cognitive stress. So that shows that there was no meaningful change between the initial and the follow-up survey. Still, a noticeable number of individuals reported that they have some symptoms, more cognitive stress symptoms than somatic stress. We also ask about how there was a participant in the survey answer to these questions, and questions were around having time to complete work tasks, getting behind work, and work that is unevenly distributed, and worriness about becoming unemployed, and worriness about decreasing salary. You see here that the questions around workload, that the majority of the individuals believe that the workload has been the way that they are kind of either falling behind or not having time to complete the task. And that is clear demonstrations of what could be the cause, as they have they adjusted the way that we expect our employees to work, and the demands and the distribution of the demand of the work to them prior to the pandemic and during the pandemic. And also looking at concerns around unemployment, fortunately, again, majority of the, not majority of them, but again, you see the difference between initial and the follow-up survey. You see that those that participated in our surveys felt more comfortable with an employment and with salary decrease that they kind of I think feeling more stable in that employment. With that introduction about the demographics and some basic statistics, I'll hand over to Dr. Noor Zikia to walk us through some of the details around the psychosocial questions that we ask and some of the statistical analysis that we did for this study. I'll hand over to Dr. Noor Zikia now. Thank you.
Great. Thank you, Dr. Yazdani. And I wanted to thank the Canadian Institute for Safety, Wellness, and Performance for the warm welcome. Delighted to be with you here today and have the opportunity to share some of the details around the work from home survey and talk a little bit more in depth around both how the data was collected and then to provide some preliminary results that I think would be very interesting. I think what we've heard so far is that the work from home concept and idea is here to stay, at least I think it is, and that it's impacted different segments of the workforce, and we have to be very mindful of that. For example, looking at it through a sex and gendered role and lens would be very interesting, but also very fruitful in ensuring that for example, those that identify as women are receiving the supports and resources that they need to certainly not only participate in the labor force, but also to have good and great mental health. So I want to talk a little bit about how the data was collected and what do we use to collect it. So we used an instrument or a measure or a survey called the Copenhagen Psychosocial Questionnaire version 3. As you can imagine, there's 2 versions before it. Really, it's been used and described in the academic literature to assess either occupational risk or to conduct research on work and health. So it really gives you an opportunity to understand what's going on between the interplay between work and mental health in particular. In fact, it's used very often to look at the psychosocial mental health of the work environment. And what's great about the Copenhagen Psychosocial Questionnaire is that it's broadly used globally. So there are norms to the data in Europe. Here in Canada, I know that the Institute for Work and Health and the Ontario Health Clinics for Workers, OCAW, has done some of that work to get the reference data. And we use this questionnaire to examine workplace mental health issues in this particular population. So in addition to what it's being used for and how it's measured, it comes with essentially 3 different versions. And believe it or not, the initial conception of this instrument was that the longer version would be for research purposes, and the mandatory and middle iterations of the survey would be, for example, for quality improvement or used for in workplaces to examine workplace mental health. But they found that with the 3rd version, you actually needed a short version that was also valid for research purposes, because oftentimes we want to ensure that people complete these types of surveys, but recognize that they have a finite amount of time to do it in, and not everybody will want to engage in completing surveys. The other thing to consider when it comes to the Copenhagen Psychosocial Questionnaire is that it covers many dimensions. So we heard about some of the dimensions in the descriptive statistics that were presented by Dr. Yazdani, but there are others as well. So for example, it looks at work organization, job contents, interpersonal relationship, leadership, work individual interfaces, social capital, and many, many others, depending on what is collected. So it provides a rich repository of information that we can really examine more carefully and get a much better understanding of what's going on in the workplace. And it's also, like I said, widely used. So it's available in 18 languages and it's across 40 countries globally. And as I alluded to earlier, the reference population for the Canadian group is mostly from Ontario and Quebec. So there is a reference population for Quebec, and the French language version of it is different than the one that's used in France. But so we're very fortunate that there is reference data for the Canadian population as well. Can we go to the next slide, please? So in this slide, I just wanted to provide you with an overview of what the instrument is all about. You heard me say to you that there's different versions of the survey. I hope you can see it. I apologize if the text is very small. I was trying to convey the message that there's different versions of the questionnaire, and that each one will have different dimensions that it covers. So if you take away that, I think that's the key message. But if you're interested in looking at more of the dimensions of the instrument, they're on the left-hand side. So there's things like dimensions such as quantitative demands, cognitive demand, emotional demands, and you can go down the list. And some of these may be of particular interest in different industries. Some of them may be valuable to look at across the organization. So for instance, in healthcare organizations, there's quite a bit of literature looking at role clarity and role conflict, quality of leadership. In other sectors, perhaps there's more of an emphasis on insecurity at work, or general health or mental health and vitality. So there's a lot of ways of looking at the data at the questionnaire and customizing it to how you want to measure it in your reference group. Can we go to the next slide, please? So in this illustration, what I have here is kind of a so-called heat map. And if you allow me to indulge you in explaining what this really means, is that if you look at the column on the left-hand side, so where it says quantitative demands and so forth, and then if you go down those dimensions, you'll see scores that are in the green color, and then there's some in the yellow color, and then there's some in the red color. So if we look just at the very first row where there's quantitative work demands, you can see scores in green are where things are okay. There's no cause for concern, at least not at that point in time. While yellow, just like a yellow traffic light or an amber light, would tell you that, hold up, you should start paying attention. And anything in red is a cause for concern, meaning that scores in this dimension for quantitative demands are, for example, 5 to 8. This is an area that potentially will require greater attention and an evaluation of the occupational risk factors, and looking at that psychosocial work environment when it comes to quantitative work demands. Similarly, we'll just look at another example, the one below it, with work pace. Elevated work pace levels are of concern, and you see that across different sectors and workforces. This is not something that's unusual. We're seeing this in other work that we've done as well, is that elevated work pace levels. And across the Copenhagen Psychosocial Questionnaire, you'll see this type of evaluation. Now, some of them are reverse coded, so don't worry about that, but it's just to say that there is a designation for either increased scores leading to deleterious health outcomes or decreased scores. And I just wanted to give you a sense of how all of this information comes together. Next slide, please. So here's some good practices and usage that I've certainly adhered to. There are many others. I couldn't cover them all in a short presentation like this, but if you're interested, I'm happy to share more of that with you. So essentially, do the survey when there's a need. It's not necessary to just do the survey for the purposes of doing a survey. That goes along with any type of good practice when you're looking to solicit information from your workforce or other groups, meaning that if you're asking a question, first ask, why is this information important to collect? And then when you have that answer, then that should allow you and guide you to whether or not it's necessary to proceed with the survey. The second one is to ensure that surveys are voluntary. So, I come from an academic perspective. So when we do any type of work like this, we have to go through a rigorous ethics board review. So to us, we have to ensure that our work is ethical, but and to make sure that it passes the quality and rigor that the university allows us to do that. So to us, it has to be voluntary. And I would say that if you're doing this type of work in a non-academic context, to put this consideration first and foremost. And if you find that response rates are below 60%, and this is just a practical tip, you might want to be looking at in an indication that perhaps people are indicating that there is a poor workplace mental health, but it may not necessarily be the only cause. It may just be that people are tired of filling out surveys, and this is incredibly common. And when you're doing this type of work in population health work, is that there is such thing as survey fatigue, and we want to make sure that we avoid that. But this could be an indication of that, and there's many ways that strategies that we have to improve response rate and mitigate against poor response values, but it's something to consider. I think the third point speaks well and talks about some of the work that if you've heard me talk at different venues, you know that I always talk about standards and the CSA group. So it's worthwhile looking at how well the Copenhagen psychosocial results are aligned, for example, with the psychological well-being in the workplace standard, and how they look at mental health and physical health in the workplace is a shared responsibility. So looking at both supervisors and managements working with or collaborating with workers and different stakeholders, for example, like unions or associations, and ensuring that the commitment is on both sides. So no longer is it good enough, and I will argue that it should be unacceptable that, for example, two organizations are dealing with mental health issues and placing the burden on the individual, but rather these organizations, or these two organizations, if you can use my example, should be saying that we want to foster an occupational health and safety environment where individuals are able to come in and talk to managers, and managers are able to have open dialogue with their workers. So there's that shared relationship, and you see that in the COPSOC as well. So the instrument allows you to do that, and it should be anonymous. So if somebody would like to fill out the questionnaire, and the questionnaire does ask some sensitive information, there's questions that would be deemed personal around stress, around burnout, around job satisfaction, that you may not necessarily want everybody to know your details, but that information is important for evaluations of programs, or of in our case, for example, in research to advance the science and to provide evidence, as we heard from Dr. Yazdani, about the work from home interface outside of that voluntary domain and within the specificity of this current pandemic. So we want to ensure that people are able to provide their answers and be able to do that in a way that there are no repercussions. And again, because we come from a university and a college side, those are considerations that we already implement into our work and ensure that we do that. Otherwise, I wouldn't be here speaking to you, because we wouldn't be able to collect their data. Next slide, please. So in terms of the data analysis and what we looked at, there were a couple of things that we did. One is that we looked at the data set as a whole. And and the team here at in the Department of Occupational Science and Occupational Therapy led that part of the analysis. And we started to analyze the data, ensure that it was appropriate for some statistical assumptions, and then plan to do some inferential statistics, or essentially statistics where we can interpolate and come up with some generalizations to go beyond what we would typically call descriptive data. And one way of doing that is that we proposed looking at some logistic regression and creating two models as a starting point, and then looking at demographic and occupational factors, and we would fit those into the model, and then to look at those through the logistic regression approach. And essentially what we did was that, and this is a little bit more technical, but I think it's worthwhile just knowing some of this in terms of the nuts and bolts for those of you that are on the call and kind of want to appreciate how we referenced or categorized our groups. For example, we used one as our reference category. We used a forward stepwise logistic regression, and we used a significance of 0.05 with a 95% confidence interval. So all of this to say is that we use standard statistical approaches to fit our models and then to come up with some general models that would understand and look at the relationship between different dimensions of the COPSOC and the variables related to demographics and occupation. Can we go to the next slide, please? Thank you. You read my mind. So in terms of the preliminary results, and these are very preliminary, we found that there were statistical differences between working from home in the cohort and the Canadian norms for the COPSOC across the dimensions, and the dimensions are highlighted there. So this shouldn't be a terrible surprise to anybody here. I think if you think about it for a moment, even without too much thought, I think you can come to the conclusion that the norms were established before this once-in-a-generation pandemic, and that now we're finding that there's some statistical differences. Rightly so, in my opinion, this is my conjecture, is that the COVID-19 pandemic has placed tremendous amounts of pressure and burden on our physical and mental health, and it's impacted us not only in the workplace, but well beyond that. And we found that these types of differences were also highlighted in the following domains. We also found, interesting enough, there was differences between those that were self-employed versus those that were employed by an organization, or of different sizes as well. And generally, we found that those that were self-employed experienced higher quantitative demands and greater insecurity over working conditions. And that shouldn't come as too much of a surprise, again, because of the fact that generally, if you're self-employed, you're taking on more of the risk in terms of the relationships you build and your work, and this could be severely impacted because of the pandemic. We also saw some relationships between enterprise size, so the size of the organization, and those, and for example, burnout scores. Not surprising, and some of the work that we've done in the past also confirmed this outside of a pandemic context, is that smaller enterprises, so those SMEs, if I can call them that, small and medium enterprises, were more likely to report higher burnout scores than larger workplaces. And I've got a couple of thoughts as to why that might be. As we saw, most of this sample was for working in larger organizations, so it could be that they're better resourced, and typically they are. They usually are able to provide workers with more flexibility, more accommodations. The ability to work from home might be more available than in the SME population or the SME groups. So that might explain why certain workers or the respondents in the sample might be alluding to higher burnout scores on the COPSOC. I will end by saying the following for this section. A couple points. One is that we're looking very carefully at the sex and gender lens, and we're looking at the differences between those that identify as female versus those that identify as male and others. And we're finding some very interesting differences. You heard about some of those from Dr. Yazdani's earlier slides, but we're also delving those much more deeper, and we're publishing the results right now. So I invite you to, if you're interested in learning more about this, by all means, feel free to contact the Canadian Institute for Safety, Wellness, and Performance, and stay tuned. We'll have much more detail about the results in terms of our modeling, in terms of the outcomes, available very soon. We're working on delivering and disseminating some of these findings, both in peer-reviewed journals and other ways as well. And I'm happy to share some of those results once they're available. So I think on that point, I'll turn it back to Dr. Yazdani.
Thank you so much. Thanks, Dr. Nourzikia, for the presentation. And I think what we learned from Bethine's presentation really shed some light around some of these elements that we were looking at in this study. I just want to emphasize that we have not completed the analysis, but soon we'll be publishing our statistical analysis of the data. So stay tuned. What I want to kind of highlight in the final minutes of the webinar is around what this means for employees and what they can do. So work from home and everything around work from home arrangement is a complex concept, and we have to make sure to recognize that there is no one solution fit all type of scenario here. Post-pandemic, we're not talking about mandatory work from home. For the most part, we'll be switching to some form of flexible work arrangement. And flexible work arrangement is a very broad and umbrella term that organizations use. And that may mean that organizations may implement this in a way that they may require employees to have some sort of presence at work, or have multiple individuals to come into the office when that teamwork is essential, or it may completely mean that you can do whatever you think is right. You can, work anywhere you want. And that we've seen this in mainly in IT and technology, that there are a lot of flexibility around location of work. It's highly recommended as a means to accommodate workers, and has to make sure that organizations really look into the ways that they can possibly provide resources to the employees. Then they can stay productive and they perform the way that they're expected, and also making sure that the health, safety, and wellness of workers are protected. And that, again, all depends on how that flexible work arrangement has been implemented. Some of the concepts we discussed and we discovered in our survey could even apply to a regular office scenario where you expect workers to come to the office. For flexible work arrangement, you're often utilizing worker-centric approach, and you have to try to accommodate workers on an individual basis while you have a systematic process in place. But then again, those individual needs are really important to be considered in any work from home arrangement. So I would always suggest that think about a home office as an actual physical office in the organization. In fact, see this as an extension to physical office in your organization, as an add-on that you still have responsibilities to ensure it's safe and protect workers. Think about psychosocial aspect of work from home as you care about the psychosocial aspect of work if your workers are working from their physical offices within the perimeter of your organization. So what I would encourage organizations to do while they're promoting personal well-being strategies is to implement organizational strategies. If you talk about mental health, 90% of the resources you see out there are focused around personal well-being strategies, and they require employers to promote those. But what is that organization need to do? What they need to implement within the organization to help those individuals that they might have some needs that again could potentially impact their mental health. Again, as I suggested, there are a lot of personal strategies. Setting up a schedule, get ready for work, commute to work, have a dedicated workspace in home, schedule your time, respect that schedule, respect your limits. Again, overworking is an issue. Call and text the work body, take a virtual coffee break with your colleagues, meet by the water cooler kind of scenario here, as that you kind of perhaps meet with your colleagues when you're in the office, in the physical office, in the workplace. Help colleagues with disabilities. This is really important. And that is something that is often missed. And we have to really care about those with disabilities that might be in our team, and really support them in any way we can. Get sufficient sleep, eat healthy, exercise regularly. Those are personal strategies. Again, I can give you a list of 100 different strategies that are all well proven to be effective in improving mental health. When it comes to organizational strategies, how we can promote wellness check, and that wellness check could be a simple touch point that managers can have with their team. Frequent and effective communication, very important. You have to be transparent. You have to demonstrate desire to address employee concern, even about child and family duties, sufficient equipment to perform duties, recognizing that employees are dealing with different situations at home, and that is very important. Allow schedule flexibility. Some individuals might have caring responsibilities. You have to make sure that you really allow them to have that flexibility. You have to also accommodate those with caring responsibilities. This is very important. About 35% of Canadians, they provide unpaid care to a care recipients that is not their children. We're talking about elderly parents, friends and family that they have needs. And this is a significant burden on many of them. So that is really important. How we can, as an organizations, really accommodate those with caring responsibilities. We CSA, and I was part of that working group, developed a standard around care inclusive organizations, a standard B701, that is published and available. How you can actually implement some of the elements within that standard. Role model good stress management, empathy and psychosocial support. Promote maintaining a routine work-life balance, physical activities and scheduled breaks, and also provide required technology. Most importantly, as an ergonomist, ergonomically designed equipment. Those are essential to ensure the organization really have these strategies in place to demonstrate that they support employees in managing their workload and better addressing their health and well-being. Again, these are just some examples. There are a lot of other strategies that could be implemented, and there are a lot of resources out there. You do not need to reinvent the wheel. There are a lot of resources out there that can help you in implementing an organizational strategy to address mental health in the workplace for your work from home population and for others within the organization. And then I would like to thank everyone for participating in our webinar. And now I'll hand over to Sophia to moderate QA session. Thank you.
All right. Thank you again, Dr. Yazdani and Dr. Nawrazi Kia for a great presentation. And again, like Amin just stated, thank you to those of you who submitted questions for our speakers today. We will now begin our Q&A session and answer some questions. So we actually got in 4 questions today. So I'll begin with the first one that's popped up here. So the first question, are the benefits of work from home specific to working from home, or might these benefits also be achieved by changing how work is done at the office?
I may take that. Very good question. Absolutely. The whole concept of office work is around how we can build strategies to effectively utilize the talent within the team, the talent within the workforce. It all depends on how you decide to improve the productivity and performance. Again, most of the benefits I've presented today is taken from productivity and performance literature, and that is mainly around those flexible work from home arrangements that are voluntary. And of course, many of those benefits could be achieved by changing how work is done in the office. It also impacted by even how we allow individuals within our teams, how we allow employees, how we allow the workforce to think and care about the physical and mental health well-being. Prolonged seating, for instance, is a significant problem that could cause a lot of issues for the physical health of our workforce. We often, when we work from home, sit for hours in these meetings. For example, I woke up today at 6 a.m. because we had an international meeting with a group in Japan from 7 a.m. to 11 a.m., right? And for 4 hours, I had to be sitting, right? You know, when you are in the office, that happens again. Like, you know, you go to these long meetings, and we know by some of the research conducted by colleagues at University of Waterloo that, you know, is recommended that you change your posture every 45 minutes, every half an hour, right? That not only impact your physical health, but your mental health as well. So how we can allow and how we can communicate that, for instance, we can avoid prolonged sitting is very important. It doesn't matter if you're in the physical office in your workplace or you're in the home office. About 38% of our survey respondents said that, our survey respondents suggested that they spent 83% of their time in sitting posture. So that demonstrates that, well, there is a significant issue here. It is not right to be sitting that long. So it doesn't matter. You are in your home office. If you are in a physical office, you need to practice these suggestions, and then really kind of try to put in place strategies to promote healthy behavior. Thank you.
Great, thank you for that. So we'll move on to our second question here. Ask, the benefits and challenges of work from home seem in direct conflict with each other. How do you explain?
Absolutely, I totally agree with you on that. And also, this is informed by research. So the work from home literature, you often see a lot of conflicting data, and that is based on what emerges from different population when it comes to work from home, and is mainly learned through the voluntary work from home or flexible work arrangement literature. And again, there are metrics to our work from home productivity and performance study. We realized that work from home can have positive impacts on many of those metrics, but those are commonly, again, reported in the voluntary versus mandatory, and again, you see that the literature specifically for mandatory work from home arrangement is very split between the benefits that work from home has on the productivity performance, and some of the challenges that the organization may face. What we learned from our work from home productivity and performance study was that although you see a decrease in some of these metrics, the situation becomes better, and organizations and individuals become more productive as they progress and as they get used to working from home. But there are certainly both benefits and challenges, and that all depends on how you implement your work from home program.
Great, thank you again for that, Dr. Yazdani. I will go ahead now with the third question. We'll be a little time sensitive here, but here's our third question. Are the initial and follow-up surveys being used to see how people adjusted to work from home?
I can answer that question, and maybe Bethin can jump in as well if he wants to. That was certainly the intention. That's why we've kind of reached out to those that participated on the initial survey. And that was kind of the intention, for sure.
Yeah, I think that's exactly it. We want to see some of those, the temporality change, particularly as the follow-up survey was done later on, and we were probably well into the third wave at that point. So I think it would be very interesting to look at some of those analyses further, and that's what we're doing right now.
I just want to highlight that the organizational strategies that I've also discussed today, because that I see a question around this as well. Again, those are available. Mental Health Commission of Canada has really good resources. CSA standard on psychological health and safety, CSA Z1003, has some framework. Again, could be a lengthy document, but there's some framework out there as well. And if you're looking at some more resources around this, and I think there will be more resources coming out that could potentially help employers, not specifically to work from home, but we have actually launched a guideline looking at addressing operational stress injuries among paramedics in Canada. So that is also, that highlight 10 organizational elements that could be implemented within paramedic service organizations in Canada to address operational stress injuries. And some of those, again, elements could be easily applied to other sectors and to work from home population as well. Thank you.
Great, thank you, Dr. Yazdani and Dr. Navrazi Kia. I think moving forward, we can go ahead with the next slide here and bring our attention to our upcoming webinar schedule. So as on the thing here, we can see, please visit our website and our social media channels, both our Twitter and LinkedIn, to find update schedules and registration links. We hope to see you at our future webinar on November 22nd, where we will be digging deep into navigating work-life balance. If you happen to miss a webinar or can't make it to one of them, you can find all of our past webinar recordings on our YouTube channel, which is at CISWP. Thank you again to everyone for taking the time to join us today. We hope to see you at a future webinar of the series as our researchers will be discussing their findings in more detail. Thank you, and I hope you all have a great rest of your day.